opening protocols, distinguished ladies and gentlemen. I listened to the previous speakers, and I believe that all that is left for me to do is to give the vote of thanks. So, without any further ado, I take this opportunity to express sincere thanks to the People's Republic of China for this very generous gift. As you know, the People's Republic of China would have donated 2 polyclinics, this one here in Villa, as well as a community center, and similarly in Glanvilles, they would have donated a polyclinic and community center. We are certainly very pleased in this community to be the recipient of such a generous gift. And truth be told, this community would have benefited significantly from the funding coming from the People's Republic of China. You would know that the port facility is located here in this constituency, and we'd have gotten a concessional loan to the tune of $90 million from the People's Republic of China, which would have meant that between this polyclinic and community center, this community would have benefited from in the region of about $100 million. And there's more to follow. In fact, Ambassador Zhang and I would have spoken about the funding for the Point Bubi Ali Community Project, housing project. And my understanding is that that project is advancing. We would have given an undertaking that we'll have the area cleared shortly so that we could construct resilient housing for the people of Point, most of whom we have relocated already. And we hope to have the area cleared within a matter of 60 days. So the People's Republic of China has been very kind to Antigua and Barbuda. During the last 3 decades, they would have, through concessional loans and grants, contributed in the region of about $1 billion towards the development of Antigua and Barbuda. And if you were to subtract the contribution of the People's Republic of China, I guarantee you that the rate of growth that we have experienced over the years would have been significantly less. So for that, we are eternally grateful. And the People's Republic of China can continue to rely on the support of my administration in the international forum as we continue to collaborate on issues to include climate change and even reform of the United Nations, and of course the other areas in which we have been collaborating over the years. China has proven to be a very reliable partner to Antigua and Barbuda, and certainly China can continue to rely on the support of my administration, the government and people of Antigua and Barbuda. Now, primary health care is extremely important. It is really the foundation of any healthcare infrastructure. And I'm very pleased that my administration would have, from the onset, and even before we formed the governance of the country, identified healthcare and education as the pillars of our development, and would have committed a significant amount of resources to enhance the healthcare as well as the education infrastructures in our country. You'll be aware that we now have the Fort-landed campus of the University of the West Indies here at Five Islands. And insofar as our healthcare facilities are concerned, we continue to build out the facilities to the extent that Antigua and Barbuda today has one of the highest beds per 1,000 of any country within the Caribbean region and beyond. If we were to include the 2 field hospitals which were donated by the United States government, we are close to 4 beds per 1,000 of population, when in many countries they have an average of 2 within the Caribbean region. And this is not a coincidence. I mean, even here at this polyclinic, we're in a position to accommodate patients here. And you would know too that we built out an ICDC facility, that is the Infectious Disease Center, during the pandemic. We also reconfigured the facility at Nugent Avenue and would have made that into a hospital. So as a consequence of the various facilities that we would have either constructed from scratch or would have enhanced, we now have in the region of 4 beds per 1,000. And for this, the people of Antigua and Barbuda should be very proud. Now, what we're doing also is that we are decentralizing healthcare. We're bringing healthcare to the people to make sure that primary and in some instances, as in the case of this Villa Polyclinic, that secondary healthcare services are available to the residents. And you must understand that we cannot transform this country into an economic powerhouse without unhealthy people. So we would have established from the onset, literally develop a nation of wealthy and certainly healthy people. But at the same time, we want to make sure that those who do not have the wealth, that there's no displacement. So whereas all of us have aspirations to increase our wealth, the issue of healthcare delivery, especially at the primary and secondary levels, that should not be an aspiration, but actually a service that is available to all. For us, university or universal healthcare is very important. And we want to make sure that notwithstanding the economic standing of our citizens and residents, that there's universal health care for all. And that is why, too, we are now seeking to transition the medical benefits facility into a national insurance so that we can provide more services. Now, we have a threat facing the entire nation, a healthcare threat, and that is the issue of NCDs, an issue that continues to plague our people, an area in which there needs to be greater attention, greater public awareness and education in order to address the lifestyle diseases, to include diabetes, hypertension, high cholesterol, because many of our people are dying prematurely as a result of these diseases. And the reality is they are manageable. There's no reason why someone who develops diabetes should die from diabetes, because there are management let's say, skills that could be utilized in order to manage one's diabetes. Similarly, hypertension could be managed as well, and you would know too that the government, through medical benefits, provides free medication to individuals who have those diseases, including high cholesterol. But what we recognize is that the centralization of the delivery of those services has created a problem in that individuals in certain communities outside of St. John's, they have not been availing themselves of the necessary medicines. So as we continue to decentralize the delivery of services to include pharmaceutical services, we expect that by bringing these facilities closer to people, that there will be a greater take-up. People will get their medication on a more timely basis, and they'll be able to manage these lifestyle diseases and to live longer and certainly healthier lives. Now, this facility will also be utilized for public education and awareness. As you recognize, we also have a conference facility here within the overall compound of the facility. And we expect the nurses, the doctors will make themselves available to provide public educational services to our people. Because the reality is many of our people, they're just totally unaware. Many of them are negligent. Even the whole issue of testing, I would expect that our people will now avail themselves of routine testing so that they can capture these lifestyle diseases at an early stage and to be in a position to manage them. Even the establishment of a database to manage these persons' condition at the same time to seek them out rather than waiting for them to come here to get treated, for us to have a facility in which we remind them on a regular basis that they need to come and get a checkup, they need to come and check their blood sugar level, their blood pressure, etc. That is the type of proactive leadership that we expect from the staff here. My understanding is that we have someone whose parents and grandparents emanated from this area, and we're hoping that you'll provide the type of leadership, proactive leadership, to ensure that we can deliver more effective healthcare services to our people. Because at the end of the day, our people are our greatest assets, and as a consequence, we have to go the extra mile to protect them and to make sure too that we build the intellectual capital of our people. So this is part of the empowerment of our people. There are many who believe that empowerment is just about putting monies into people's pockets. But empowerment is also about providing good health care and good standards of education for your people so that you can help them with their self-actualization initiatives or aspirations, while at the same time ensuring that they can lead healthy lives. And that is certainly very important. So I'm very pleased that at least my administration would have identified healthcare as an area for primary funding, as Minister Maureen Joseph indicated. I don't recall there's any time that he would have made a request for funding and we would have refused funding because we recognize the importance of healthcare. The very fact too that he emerged as the Minister of Health was based on his own competence, his management skills to anchor this very important ministry for us. we can recall precisely what happened in the past, in which a past minister, or maybe two ministers of a previous administration, did not pay any attention to health care. And I'm not trying to be political here, I'm just stating a fact, and to show the difference in administration and the way in which we would have prioritized the delivery of healthcare services, and at the same time would have placed one of our most senior, most experienced, most competent ministers to manage the delivery of healthcare services, because again, healthcare services are very important for the continued development of our people. Now, we expect also to continue to enhance the secondary and tertiary healthcare services. As the minister indicated, we are now literally constructing or building out a renal center, and in addition, very shortly, in conjunction with perhaps one of the best hospitals, if not the best hospital in the world, we'll be establishing a cardiac unit here. We also will be doing primary research. In fact, you may not be aware, but Antigua and Barbuda today has perhaps maybe the most active stem cells facility, or at least treatment facilities in the entire Caribbean region. We have at least 30, 40 very wealthy individuals who are coming here on a monthly basis to get treated with stem cells. And stem cells have proven to be very effective therapy, even more effective than pharmaceuticals. That's an area that we're developing. We're also doing primary research to see how we can utilize stem cells to treat other ailments. And I'm pretty sure, too, that this particular hospital in the United States that we hope to partner with, that we can also do some further advanced studies on stem cells. In fact, I'm aware that they themselves are doing a number of primary research on stem cells, even to develop heart tissue to assist with various cardiac ailments. So the possibilities for the healthcare services here in Antigua and Barbuda are enormous. There are many opportunities, to the extent that we hope to have Antigua and Barbuda as a healthcare service delivery destination in which we could provide services, healthcare services, to the rest of the Caribbean region and beyond. Already it's happening. As I said to you, we have individuals flying here, very wealthy individuals flying here in their private jet or jets, literally on a monthly basis to get treated here in Antigua and Barbuda. And I'm pretty sure that within the next 2 years that we will have the type of comprehensive healthcare facility here to include not only the public sector infrastructure, but even those in the private sector who are building out various clinics and hospitals, that we will have the type of infrastructure here in which Antigua and Barbuda will become a primary provider of healthcare services within the Caribbean. Now, the benefit is not only to attract foreign exchange, but also to stop the foreign exchange leakage that would have occurred over the decades here in this country. Just yesterday, for example, we had a request for $552,000 from an individual who is very ill, trying to restore good health. Now, clearly, the government is not in a position to afford $552,000. And I presume that in the past, we may have had many individuals who may have had similar bills and could not have availed themselves of the necessary services. But by virtue of establishing those services here, we'll be able to reduce the costs. And it means, therefore, that those services will now become available to the local population. And whereas some people perhaps may have been condemned to potential death or continued ailments, these services can be brought within the means of every individual and to provide life-saving therapies and surgeries for our people. So there are many benefits in building out the health infrastructure, not only economic but social. And we are spending an enormous amount of money. In fact, on an annual basis, the Ministry of Health gets, if not the largest, perhaps the second largest budget. And if you have to take into consideration the amounts paid into medical benefits, then on an annual basis, the Ministry of Health, they get the lion's share of the government's budget. So our administration is absolutely committed towards the continued advancement of the healthcare sector. And as I speak to the issue of the advancement, obviously I have to thank the personnel in the healthcare sector as well, who collectively would have contributed towards providing better healthcare service delivery in this country, our nurses, our doctors, and all the other healthcare practitioners. We're extremely grateful for your contribution towards the delivery of high-level healthcare services. In fact, the significance of our healthcare workers would have been obvious during the period of COVID. And I believe, too, that by having very competent healthcare practitioners, as well as the physical facilities, we were able to manage our healthcare delivery to deal with COVID or to manage COVID better than most. And again, it is to the credit of all. And I thank you sincerely on behalf of the government and people of Antigua and Barbuda. Now, we have some very distinguished individuals who would have served this country, nurses. I believe a few of them are here. And I want to acknowledge them collectively. I don't want to run the risk of calling anyone, and next thing I miss one or two names. But I just want to say to you, too, that we are very grateful for the service that you have provided to this community, to the country, and we certainly will be celebrating you. I mean, you are unsung heroes. Reality is we should have done it long ago, so please forgive us. I mean, someone like Nurse Dyer is an example, and please forgive me for singling her out, but Nurse Dyer would have done over 50 years of service, and that is remarkable. I mean, when someone shows that level of commitment, which is also indicative of the service of the others, we ought to celebrate their contribution. We should not only celebrate the contributions of politicians and perhaps maybe other high-profile individuals, but these nurses who anchored our healthcare services here in this country, they ought to be celebrated, and we'll also be doing that today. And I thank you on behalf of a very grateful nation. Once again, I thank everyone for coming today, and I want to assure the entire nation that this facility will be protected, it will be cherished. I want to thank those who are managing the facility, Mr. Kem Hodge and others who helped to maintain the facility, even the surroundings, and to ensure that we keep this facility pristine and to make it a facility in which we'll continue to be very proud and one that will deliver not only primary but secondary healthcare services to the people of the catchment area, to include Pointville, Fort Road, Yorks, etc. Thank you very much.